Hello everyone, it's Matthew McKenzie here again from My Care in Mind, the YouTube channel and blog that focuses on the attention that unpaid carers provide for those living with long-term ill health. My focus usually is on those caring for someone with mental ill health or cancer. So this time I'm focusing a video on cancer caregivers, but to be honest, can be extended forms of other unpaid care, but this is particularly, a lot of it mentioned is really particularly for cancer caregivers. So as you can tell from the title of this video, focus here really is why cancer carers need to be in the NHS 10-year plan. I want to keep them on that agenda. I think it's very important. And you will see throughout this presentation in a bit why this is the case. So I'm sure you might have known it by now, the NHS is in need of reform. We can't really ignore that. So a 10-year plan has been launched in 2025, in July. And it's a new vision, really. What does it focus on? And I will try and see if I can put the link in the video description on the NHS 10-year plan. But it's brave, it's bold, it's needed. It focuses on prevention of a crisis care. As of this video, far too many are in the queue needing treatment. So one of the best ways around this is to focus on prevention rather than so many having to use hospital services. And I'm being really, really brief here. There's a lot more to it than what I'm mentioning here. The other part of the 10-year plan, its huge drive is on community-based services. So these are the hubs that we want people, patients, carers to use, rather than, and I'm saying there will always be a focus on hospitals, always be need for them. But having health services close to the community is better, I feel. Therefore, there's a greater reach. And last but not least, obviously, this is the day and age of digital technological revolution, especially with AI. And it's going to be a huge drive to get the health service to be digitalized and using that data to access information and records a lot quicker than it used to. A challenge, but a noble one, is certainly needed. Other countries around the world are staying on top of this, are focusing heavily on the digital revolution. So it's really about changing the system to meet future demand. It's future-proofing, really, not just racing to meet the challenges now, but for the future, hence the title, Fit for the Future. We cannot ignore this. It's got to start somewhere, and the best time to do this is now. But that's not the full story, as you can see from this video. Now, a bit about myself anyways. I run the National Cancer Caregivers Forum. We often use the forum to engage with services. Sometimes services are very patient-centric, and I guess there's many reasons for this. When your loved one or someone close is diagnosed with cancer, it can be obviously intense, emotional, and can often be long-term. Carers often face the following, and I'm being really brief about this, to be honest. They have to help navigate, especially complex medication routines. And they're not trained to do this, but the patient will perhaps have to rely on someone close, family, friends, close friends, I would say, even neighbors. Without a doubt, carers often face emotional distress, decision fatigue. No one else, not in a hurry anyway, will make those decisions. And along with that will come guilt, anxiety, depression, worry about the future. There are end-of-life challenges. There are situations, unfortunately, cancer is diagnosed too late, or it's an aggressive form of cancer, carers, unpaid carers, informal carers, cancer caregivers often have to face end-of-life challenges. So looking at the things that I've just pointed out here, as a reminder, I feel anyway, and this can extend to all forms of unpaid carers even, but not really just support. I feel we are and should be part of the care team, especially if there's a focus on the community care, being close, and you can't really be any closer than your family, providing that care and support. But the NHS plan, I feel there's a lot more that can be included and should be included. What should it include? Well, there is a drive on digital access, and there's a drive on patients focusing on digital access. But if you have and rely on an unpaid care or close friend, family, then there should be digital access for carers. NHS app visibility and usage for carers. Carers themselves, as mentioned before, face challenges. They have to advocate, or there may be times they'll have to do this, especially with the population aging as it is. Those caring for elderly carers or elderly patients will need support in navigating digital care, digital support. With the use and focus on shared care workers where appropriate, it can be an extra bonus if unpaid carers are helping to help navigate that, having access to that, inputting into those records about what they've noticed about care and support for their loved ones and support for the carers themselves. And just as a reminder, unpaid carers are not really trained regarding forms of ill health, especially mental health and the cancer ill health. So training, there should be also training, health training and training on to reduce the digital exclusion. Carers are knowledgeable, they have a vested interest in their loved one, wanting to see a better quality of life. So we should include them as part of that health team. We should include them part of that system. I'll get into that in a bit as well. As mentioned, there is a focus on local support in the community hubs. Those hubs should extend to include carers as they are part of that community. So we should have care of drop-ins. And I've always mentioned, I run a lot of care groups in the neighbourhood health centres. Carers themselves, family carers, can drop into those centres, get information, advice, how to navigate the health system. Signposting back, this can go to social prescribing as well. Signposting back for respite, forms of benefits, mental health support. Remember what I mentioned before about the challenges unpaid cancer carers face, especially end of life, can have a devastating impact on mental health. Lastly, as mentioned, we should continue to focus on co-production and inclusion in system and health system design. So include carer feedback in NHS service planning. I know we have the integrated care systems doing what they should be doing, really engaging with the community on health service provision. There should also be formal care representations in reforms and pilots regarding what is needed out there in the community, and this should continue and be strengthened. So my message to policymakers is you cannot really redesign the future of healthcare while ignoring people, holding it together by the seams, to be honest, and behind the scenes. Cancer carers are not just partners and close friends. They are partners in healthcare. They're not just visitors sitting behind the patient, listening to the GP, really on what is needed. As I said, with consent, they should be included. Include us, support us, listen to us all the way from day one. So, a bit of shameless advertising. As I mentioned, I do run that National Cancer Caregivers Forum, and I feel it's a space where carers can connect, share, and be heard. And I've always, for many, many years, been running carer groups, carer connection groups, peer groups, collaboration groups. We may be small, but the voices are growing. I work hard to connect with others. So if you're a policymaker, charity, health professional, and shout out again to Macmillan Cancer Support for supporting the lived experience voice. All we are asking is try and work with us. If you are a carer or even a former carer, former cancer carer, then feel free to join us, connect. I will try and make a video on the reasons for such groups. As I mentioned, and I'll put the link in the video description, our groups runs online the last Wednesday of each month. I hope this has been a bit of an eye-opener and at least something of a discussion. I will often try and blog and raise awareness with videos and poetry and connecting and promoting the carer's voice as much as I can. Thank you for watching.